The international charity group Médecins Sans Frontières, or MSF, has warned that the health of displaced flood victims in South Sudan is likely to deteriorate further without further aid. Earlier, I spoke to MSF's country representative, Bernard Wiseman. Bernard Wiseman, Head of Mission for MSF in South Sudan. Thanks very much indeed for joining us on the program.
Thank you for having me, Peter.
All right, let's start by describing the lay of the land. These floods were pretty serious. Tell us the kind of devastation that it's caused, damage, and what you're seeing on the ground.
As reported by the UN, what we're seeing across South Sudan is around 400,000 displaced because of the flooding this year. A lot of that is taking place in the states of Jonglei, kind of where a lot of MSF projects are located. We have a project in Fanga County and Ayotte County. I personally did an assessment to see some of the flooding last month, and what we've seen are entire villages completely destroyed, populations who are kind of displaced and onto small crowded islands without any food support, without any water and sanitation access. And it's really kind of a very precarious situation that we see a lot of communities in at the moment.
So as MSF, what are some of the areas of greatest need straight away?
Obviously MSF is an international medical humanitarian organization, so our specialty is really with kind of medical services. Some of the populations that have been affected by the flooding and the displacement we've gone directly to for mobile health clinics, did some assessments on nutritional access. Some of our assessments early on were quite concerning because some of the under 5 malnutrition rates that we saw were quite elevated. About 20% of some of these villages, the children under 5 were acutely malnourished. We've seen high cases of malaria, diarrhea as associated with low levels of water and sanitation. So our first response always is medical. And over the first 5 days of our response on these small islands, we've seen over 650 consultations, which is a huge number. So obviously the medical needs are quite high.
You mentioned poor sanitation and, of course, flood waters. I suppose a concern must be waterborne diseases.
Yeah, correct. As I mentioned, we've seen cases of diarrhea. When these communities have fled and been displaced to these small islands, these are really islands in the middle of rivers or lakes, and they don't have any infrastructure. So there's no potable water, there's no latrines. So the water that they are using to drink or to cook, it's really coming from the same water that they have to use to defecate or to bury their dead. And so the water and sanitation situation is quite terrible. But we're also seeing large numbers of cattle and other livestock that have died because of the flooding, and these animals are also in the same waters as well.
So what assistance is required now and urgently? You know, you're making, I'm sure, an appeal to the world to assist. How can they help?
There has been a good response, but I think more is needed. What we're seeing is high cases of malnutrition, the need for non-food items like shelter, mosquito nets. We're looking at protection issues as well as water and sanitation. So I think what we see is that these kind of flooding and these events this year are quite historic. It's not seasonal flooding, and I think we have to spread that message that the displaced are displaced in a very precarious situation because of levels that they've told me personally they have not seen in decades. And so I think more response is definitely needed and would provide a little more safety and security to the populations.
If this help doesn't come soon, what is the danger? What are you most worried about?
Obviously, some of the areas that MSF were able to respond to, we were able to stabilize some of the health status of the communities. Some of the severe malnutrition has been able to decrease. However, if food security isn't obtainable, if we can't produce some nutritional supplements to some of these communities, we're only in the middle of the rainy season at this point. So if you project over the next month or two of rising waters, maybe increased displacement, we could see these populations in even worse positions.
I would imagine access is something that's very challenging for you at this time, particularly because of the floods. But even before that, there are some remote areas where people just wouldn't go to hospital because they were too far away.
Yeah, and then those are usually the areas that are hardest hit by the floods, the ones that are less accessible. We've seen a good response into some of the areas in Jonglei State that are accessible by aircraft or helicopter, but the communities that we're seeing, we haven't seen much of a response. It's really only MSF that has the capabilities to get to those areas, provide some support to those communities, and we're really calling on other actors to try to focus on some of these more rural, less accessible areas, because we think these may be the most vulnerable populations.
It sounds like a pretty desperate situation. I read a story that a 26-week-old child was born very premature in the middle of all of this.
These kind of events can have a big stressor on the communities. So the vulnerable communities are even more vulnerable. Pregnant women, young children are often very, very affected by these precarious situations. So the health needs are obviously really apparent. And so it's something that MSF is working on, but also other actors as well, to try to stabilize some of these communities.
Is it still raining? I mean, what is the situation? Is it just floods that have come and are now starting to subside, or is there danger that this will escalate?
Yeah, for some of the communities that we're working in, it's probably the middle of the rainy season. So we're concerned that the water will continue to rise. I'm not a climate scientist, but obviously the levels are quite concerning and to me quite historic, and also to the communities that have talked with me. What they're saying is this is the highest levels they've seen in decades, and the water over the last dry season did not reduce. And so potentially this could be a problem for the short term, for the longer term as well, not just for the rainy season. So obviously, if it's still raining and beginning to rain in southern countries just south, potentially in Uganda, then obviously we can see some elevated flooding over the next few months.
Have you seen any fatalities as a result of the flooding directly?
It's sometimes hard to link directly the fatalities to the flooding, but obviously putting a lot of crowded people on very small islands is can very quickly spread to death and high rates of accrued mortality. So obviously it's a very difficult position to put the populations in. So we're concerned. We're quite concerned about that.
All right. I mean, you're dealing with everything else, sanitation, diarrhea, vomiting, the whole nine yards. And this is in the middle of a pandemic. Is this something that's on your radar as well, COVID-19?
Some of these areas are quite remote, and so we have really concerns about spreading of COVID as well. So especially for a medical organization, whenever we do these type of responses and assistance, we have to have really good protections in order to make sure that there's no transmission of COVID as well. But obviously there are a lot of other morbidities that we're also really concerned about as well.
Yeah, I think you might have mentioned it, but mosquitoes, malaria must be a huge concern.
Yeah, this is kind of the peak malaria season for a lot of areas within South Sudan. We've seen kind of high levels in other areas and as well in these flooded areas in Old Fangak or Fangak County. So increased malaria compared to the years previous. And so obviously with some of these displaced populations, if they don't have items to protect themselves against mosquitoes, there's no mosquito nets, or if there's a lot of standing water, it's very difficult to prevent malaria. And obviously with their remote location, their access to medical care or into malarial treatment is very low.
All right, and perhaps finally, just remind us, just so that people are aware, what is the greatest needs? What really needs to be done in terms of help straight away?
Yeah, for us is to put a little more attention onto the populations that need. I think what they're requesting and what they're asking for is greater stability within these areas. Obviously, water and sanitation is one of the first concerns that we see in these areas: clean drinking water, latrines, and also a little bit of nutrition assistance, as we've seen kind of really high rates of acute malnutrition among the children under 5. So those are two very strong and very important sectors that we really need to push to come to these remote communities and help provide some assistance.
Bernard Wiseman, Head of Mission for Médecins Sans Frontières in South Sudan. Thanks very much indeed for joining us, and we wish you the best with the important work that you're doing in that part of the world.